Hello, my
Hello.
name is Colette Moore, and I am your student nurse practitioner for today. How are you
Nice to
today?
meet you. I'm fine.
Okay, so can I have your name and date of birth?
Yes, Sonia Watson, March 17th, 1969.
Okay, that will make you 51 years old, am I right?
Yes.
Okay, Mrs. Watson, what would you like to be called?
Mrs. Watson is fine.
Okay, before we get started, I just may have some general questions for you. Are you going to be okay with that?
Yes, ma'am.
Okay, why don't we just have a seat?
Okay.
What brings you in to see me today?
I'm here for my annual checkup.
Um, I, when is the last time you had your annual checkup?
Last year of 2020.
Okay. And was everything good?
No, my blood pressure was elevated.
Okay, very good. I just got the reason for your visit today, so why don't I ask you some more questions and gather some general information?
Okay.
Okay. Any childhood illnesses or injuries?
No.
And are you up to date on all your immunizations?
Yes.
Okay. Any trouble with driving or getting around?
No.
Okay. Any trouble getting dressed?
No.
How is your ability to do things around your home?
Average.
Okay, good. Do you have people at home who can help you when you have trouble doing things at home?
Yes.
Okay, good. I think I understand your current problem. Now I'm going to ask you about your medical conditions and overall health. I'd like to find out about your past medical history. Have you had any major illnesses?
No.
How would you rate your health on a scale of 1 to 10? 1 being poor and 10 being excellent.
7. Because I try to maintain a healthy lifestyle.
Okay, good. Let's talk about your illnesses and your conditions. Can you tell me more about this?
Well, I have high blood pressure.
Since when?
Since 3 years ago.
Okay, 3 years ago would have been 2017, am I correct?
Yes, ma'am.
Okay, and what else do you have?
Anemia.
Very good. Okay, and how long have you had anemia?
I had anemia like for 10 years.
For about 10 years.
Yes.
Okay. And what else?
Also, I have anemia, and I also had a peptic ulcer.
Okay, how long ago was this peptic ulcer?
Peptic ulcer was around 2009, 29.
Okay, very good. And what else do you have?
Also, I have headaches, and I take over-the-counter Tylenol for those.
Okay, how long have you had headaches?
Like a week.
So this
A
is
week.
fairly new to you.
Yes.
Okay, very good. And what else do you have? Anything else?
No.
Okay, good. Any other surgeries?
Yes, I had carpal tunnel surgery in my right and left hand.
Okay. When did you have it?
I had one in 2009, and then I had a second one in 2012.
Okay. Any recent hospitalizations?
Yes, I was having weakness, and I was diagnosed with having a stroke.
Okay, when was this?
This was 12/2020.
Okay, so in December 2020?
Yes.
Okay. Any psychiatric illnesses?
No.
Okay. Well, let's talk about your medications. What medications are you currently taking?
I am taking hydrochloride,
How many milligrams?
50 milligrams,
And how often?
once a day.
Okay, and what else are you on?
Losartan,
Okay, how many milligrams?
50 milligrams,
How often?
once a day.
Okay, very good. And anything else?
I also take over-the-counter Tylenol for my headache.
Okay, how often?
Not often. I'll say once a day, only when I have a headache.
Okay, so about once a day when you have a headache?
Yes.
Okay, and what else?
And just my high blood pressure medication and the over-the-counter Tylenol.
Okay, so can you give me the 2 names of your high blood pressure medications?
Yes, hydrochlorothiazide and also Losartan.
Very good. Okay. And do you use any other thing?
No, just over-the-counter Tylenol.
Okay. Okay. How about any supplements or herbal products?
Oh yes, I do. I take this herbal tea.
Okay. You take ginger, peach, turmeric herbal tea. Oh
Yeah.
yeah, it does say herbal on it. Thank
Yeah.
you, Mrs. Watson.
No worries.
Okay. Any home remedies you take?
Yes, garlic.
Okay. So what does garlic do for you?
It helps lower my blood pressure.
Okay. So it helps. So what do you do with the garlic?
I chew it.
Okay. All right. Let's talk about your allergies. Do you have any allergies to medicines, foods, or other factors?
Yes, ma'am.
Okay. What kind of allergies do you have?
I am allergic to penicillin.
Okay. What happens when you take penicillin?
I break out in a rash, and I break out in a rash.
Okay. About how many years ago did you take penicillin?
That was around 10 years ago.
About 10 years ago? Okay. And what other allergies do you have, Mrs. Watson?
Also, aspirin
Okay. What happens when you take aspirins?
and lower my blood count.
Okay, I see. And what other allergies?
I'm allergic to peanuts.
Okay, what happens when you take peanuts?
I break out in a rash and I have trouble breathing.
Oh, wow. Okay, that's heavy. Okay.
And I'm also allergic to cats.
Oh, my goodness. What happens when you get
I
near
sneeze
cats?
a lot.
Okay. Oh, wow. So, do you often have your blood pressure checked?
Yes, I do.
How often?
Like 2 to 3 times weekly.
2 to 3 times a week? Okay. Do you keep a record of your blood pressure?
Yes, I do.
Okay. And what are your results?
It's normally 140 or higher on the top and 90 at the bottom.
Okay, I see. Okay. When was your last menstrual period?
Last week ago.
Okay. And are these menstrual periods regular?
No, they're irregular because I'm on Depo-Provera, which is a birth control.
Okay, we'll put this under your medication list. You take Depo-Provera.
Okay.
And what are you taking the Depo-Provera for?
Birth control. Form
Okay.
of birth control.
And how often?
I take it 3 months.
3 months?
Every 3 months.
Every 3 months. I see. Okay. And are you having mammograms done?
Yes, I have mammograms done annually. I have one in 2020.
Okay. How about Pap smear?
Yeah, 3 years ago.
You
I
had a
had
Pap smear 3 years ago. Okay. And are you getting your flu vaccine every year?
No.
Okay. Is there a reason why you're not taking your flu vaccine every year?
I don't feel the need for the flu vaccine.
Okay, I see.
I try to maintain a healthy lifestyle.
Okay, I see. Now I'm going to ask you some questions about your family history, Mrs. Watson. Okay. Has anyone in your family had any medical problems?
Yes, my mom, she had high blood pressure, diabetes, and she died of ovarian cancer.
Ovarian cancer. Okay. And do you know how old she was when she was diagnosed with diabetes?
Yeah, around 53. She was 53.
And how old was she when she was diagnosed with high blood pressure?
Probably in her 50s as well.
Okay, in her 50s. And what about, how old was she when she died of ovarian cancer?
Around 53.
53? Oh my gosh, so all this was new diagnosis and all of this at a cost.
Yeah.
How about your father?
Never knew my father. My father died when me and my sister were younger.
Oh, I see, okay. And any other siblings?
Yes, I have 3 sisters, and
Okay.
I had a brother, but he died of cancer at 37.
Okay, and your 3 sisters, are they overall healthy?
Yes.
Okay, any other medical conditions that run in your family?
Yes, my family died of cancer before the age of 65.
Oh, I see.
Most of my family.
Okay. I'm sorry to hear about this. Okay. Now I'm going to ask you some questions about your personal background and social history. If I ask you any questions that are uncomfortable to you, let me know.
Okay.
Where were you born?
Los Angeles, California.
And how far did you make it in school?
I'm a college graduate.
Okay. Are you married?
No, divorced.
Okay. Who do you live with?
I live with my 2 sons and 2 daughters.
Okay. And all of these are under the age of 18?
No, I have one 18-year-old and I have 3 younger. That's younger.
Okay. So these, are they all dependent on you?
Yes.
Okay. Do you feel safe living at home?
Yes.
Is there any violence or abuse in your home?
No.
Okay. Do you live in a house or an apartment?
A home.
Okay. What do you do for a living?
I'm a scan coordinator and I also have a real estate license. I'm a licensed realtor and I work HR department.
Okay, what is a scan coordinator?
Scan coordinator is basically price and integrity. We're the one that makes sure that when you get your order rung up at a check stand that is scanned properly and is entered by price integrity, that what you're actually paying for is what's listed as the valued price.
Oh, I see. Okay. Now, do any of these jobs pose hazards or risks to your health?
No.
Okay. Very good. Do you smoke cigarettes?
No.
Do you use any tobacco products?
No.
Have you ever smoked or used tobacco products?
No.
Okay. Do you drink alcohol?
Occasionally during special events,
Oh,
I have a glass of wine.
okay. So how often would you say that you have a glass of wine?
Just during special events, not
Okay.
often.
Is that about 2 to 3 times a year? 4
Like
times?
around that time,
Okay,
twice a year.
2 to 3 years. Okay. Do you do any recreational or street drugs?
No.
Okay, very good. Any caffeine products?
Yes,
Okay.
I drink coffee and soda.
Okay. How often do you drink coffee?
Just like twice in the day,
2 times? a
morning
day?
and evening.
Okay. How about sodas?
Soda daily.
Daily. Okay. Sounds very good. Soda's always good, but it's a caffeine product.
Yes.
Are you sexually active?
No.
Okay. Were you in a committed relationship right now?
No.
No. Okay. Tell me about your diet.
Well, I try to maintain a healthy diet by avoiding salt and sugar.
I see. Okay. What do you do to help you relax?
I read, I meditate, and I also exercise.
Okay. What kind of exercise do you do?
I walk
Okay. How many times a week and about how many minutes a day?
twice a week and between 30 minutes to an hour.
Okay. Sounds relaxing. What do you like to read?
I read the Bible because I am a Christian.
Okay. How does your religion influence your overall health?
It improved it greatly because it keeps me focused and I try to imitate Christ, which
Okay.
I am a Christ follower, so
Okay.
I try to keep my faith base strong.
So it helps you with your stress and
Yes,
overall.
overall things in
Okay.
life, yes.
Very good. You did very good on answering those questions. Now we're gonna kind of go into what I call assessment, head to toe. So I am going to start off with your head, and I'm going to ask you a few questions. Do you have any headaches?
Yes.
Okay. Any fevers?
No.
Any dizziness?
No.
Any fainting?
No.
Any trouble with your memory?
No.
Okay, very good. We will move on. Any weight loss?
No.
How about any loss of balance?
No.
Okay, we'll move on to your eyes. Do you wear glasses?
Yes.
Okay. Do you have any trouble with your vision?
No.
Any changes in your vision lately?
No.
Okay. When was your last eye exam?
I do an eye exam annually. I did one in 2020.
Okay, so we'll move on to your nose. Any runny nose?
No.
Any congestions?
No.
Any loss of smells?
No.
No drainage or anything coming from your nose?
No.
Okay, we'll move on to your mouth. Any problems with your swallowing?
No.
Any lumps or feeling of trouble chewing?
No.
Any sore throats?
No.
Any cavities?
No.
Any loss of taste?
No.
Very good. We'll move on to your ears. Any hearing loss?
No.
Any ear pain?
No.
Any earaches?
No.
Okay, we'll move on to your heart. Any chest pain?
No.
Any palpitations?
No.
Okay, we'll move on to your lungs. Any trouble breathing?
No.
Any shortness of breath?
No.
Any coughing?
No.
How about feeling fatigue?
No.
Okay, we'll move on to your breast. Any lumps?
No.
Any swelling?
No.
Any changes in your breasts?
No.
Okay, no drainage or anything coming from the breast?
No.
Okay, we'll move on to your tummy, which is known as a GI. Any nausea?
No.
Any vomiting?
No.
Any loss of appetite?
No.
You mentioned you had an ulcer.
Chocolate ulcer, yes.
Is there any burning sensation or anything?
No.
Okay, so that's well under control for you?
Yes.
Okay, good. Any diarrhea?
No.
Any constipation?
No.
Any blood in your stool?
No.
Okay, we will move on to your urine. Any blood in your urine?
No.
Do you have trouble peeing at all?
No.
Okay, any frequency or urgencies when you have to pee?
No.
Okay, can you describe the color of your urine for me?
It is clear and yellow.
Oh, very good. We'll move on to your musculoskeletal system. Any trouble walking?
No.
Any weakness?
No.
Any stiffness or pain in your joints?
No.
Okay, we'll move on to your skin. Any rashes?
No.
Any itchy?
No.
Any open lesions?
No, ma'am.
Any sores?
No.
Any changes in moles or any changes of any thing on your skin?
No.
Very good. Okay, Mrs. Watson, you did very well in answering your questions. I suggest that you continue on with your healthy eating habit, your diet, and your exercise. And please continue to take your medication.
Okay.
Are you skipping any of your medication?
No.
Or have you stopped taking any medications without the physician?
No.
Okay, so I suggest that when you have your medication next time, you bring that so we can have a thorough list of your medications. Okay?
Okay.
All right. Thank you, Mrs. Watson. Mrs. Watson is a 51-year-old female who appears younger than her stated age. She is well nourished and developed. She is not obese. She is awake and alert and oriented. She was very pleasant and answered appropriately during the interview. There was no obvious signs of distress at this time. She is properly groomed and dressed, and her attire is appropriate for this occasion and for her age. She had very good eye contacts, and she was cooperative. This concludes my presentation of this patient. Thank you very much.